So, I have tried to film this video a million times. Things kept interrupting me, and I kept filming it, and it just seemed wrong for some reason. And I figured out that maybe it's just too much information for one video, so I'm gonna break it down into a couple different videos and with different topics. Because I wanted to do like an overall, like, all my experiences for clinicals, but you guys would be here for like an hour, and I'd go on tangents and stuff like I am now. So this is going to be my overall experience at clinicals. So I'm going to keep it short and sweet and just tell you guys what I observed, what I learned, and what I did. Like, things that they let me do. And opportunities, because a lot of you guys want to know what you actually do in clinicals if you're just standing there or whatever. So yeah, so getting into that, I did observe a lot of things, and I participated mostly in everything. There wasn't much that they told me just to stand there and look at. I was very active in everything, basically. Let's see, I did observe people's behaviors a lot. I noticed certain people who, you know, like in any career, certain people who were really passionate about what they were doing. They really were empathetic for patients and their pain, and they took the time to actually, like, explain things to patients. And then there were people who were just like, I'm gonna go in there, slapping a breathing treatment, and not even really interact with people. So I saw it all, I think. Well, I saw good and bad. So, seeing the bad, yeah, you want to be like, oh yeah, that's so horrible, but you know what, at the end of the day, it comes down to, do you want to be like that person? And even if you have like a bad preceptor, you guys, they still got their license, and you still have a lot to learn from them, so just keep that in mind. And every time you see something wrong, just think, maybe that's something I shouldn't do in the future. So that's my opinion on that. But even people who didn't want to really be there, I learned so much from. So I was really thankful for that. But I don't know, sometimes I've heard horror stories of preceptors sending people to like the cafeteria for hours, or like not interacting with them, not wanting to be bothered, and that sucks. If something like that happens to you, I would definitely go to my program director and tell them, hey, you know, I'm at this clinical site and I'm not learning anything, they're not having me do anything, because at the end of the day, you're paying to be in this program, you're in this program to learn. So you really need to fight for your education, because no one's going to do it for you. How are they going to know how you're being treated, right? Again, tangent. Okay, tangent over. But yeah, so just, I guess, keep an open mind and learn what you can from who you can. Especially, I observed certain people were better at doing certain things than others, and they were asked to do those things over and over again for a reason. So when I found those patterns, I tended to go to that person for that thing to learn. Like, if they were really good at doing, I don't know, assessment, and like someone was churning blue, I don't know, that was just an example, a bad example, but anyway, you guys get what I'm saying. So just be very aware of what they have to offer, because everyone has something to offer. Even if it's you're observing bad behavior, that's something you're learning. Let's see, what did I learn? I learned a lot. I think the thing that I got the most out of clinicals is to be confident and to not hesitate, or, you know, people aren't as delicate as you would think they are. Don't like go in there and mess around with people too much and be rough, but I think I was overly delicate and sensitive with people. Like when it came to their trach and stuff, I'd be like, I don't want to hurt you, I don't want you to like freak out, but it's fine. At the end, I was just like whipping gauzes off, changing them, cleaning them. So it was quite an experience, which I guess leads me into what have I done at clinicals. So I was in a subacute, so basically it was a lot of trach care, and I would clean their trachs, I would, replace the gauzes, the ties, do a lot of suctioning on patients, which I'm going to talk about in another video. But yeah, I would suction the patients, clean their trachs. I did do one trach replacement, and I did de-trach another person, so that was awesome. It was very terrifying, and maybe I should do another video on that too, because that was quite an experience how they put me through it, so I might do that. But I want to keep this short because it's already 6 minutes, oh no. But yeah, so I did the trach replacements. I did get to do compressions, and I did get to bag people. We did showers as well for patients. Every week they go into the showers and they clean up. You have to basically bag people who are in vents to make sure, that they can breathe, so the CNAs can wash the patients and make sure that they're clean, and all that good stuff. What else did I do? I did a lot of breathing treatments, a lot of patient assessment, listening to patients' lungs and stuff. Subacutes can get kind of routine, and it's crazy because that can be kind of dangerous because you can fall off your guard really quickly, and times where things did happen to me, I was kind of not panicky, but I was like, oh, I didn't expect this to happen right now. So I wasn't completely always on my toes, which I'm pretty sure I will be in other places, but I did get a little bit comfortable and things got a little routine and stuff. But I did learn how to, in my first rotation, by the way, I learned how to kind of assess the patient, and like if the vent was going off, I kind of learned how to troubleshoot a trach and like see, oh, if the low pressure alarm is going off, maybe like their cuff is deflated, or maybe like they're unplugged or something like that. So that was kind of cool, because the first day I was like panicking with all the alarms. I'm like, how am I supposed to know what to do? Because I didn't learn anything about vents. I'm actually in my vent class now, so now it's like, oh, those things make sense now. I wish I knew. But, one step at a time. That's what your preceptors are there for. That's why you can ask questions. And the fact that they took time to tell me little tricks about vents really helped me out for this class too. So I got to see like, oh, that's what they were talking about. I can translate it into school directly and get more details from the book about that stuff. So, yeah, a lot of stuff happened. But it was a great experience. I learned a lot, and I am very grateful for that opportunity. So I'm going to wrap up this video. Stay tuned for the next video, and hopefully I can get all these out by tomorrow or the next day. I don't know. It's already late. But see ya!